You're live with iWITNESS. This is the Print's daily feature covering the coronavirus pandemic. One or another of our reporters is on the ground across the country covering the COVID-19 virus and its impact on the people. Today, I'm joined with Soniya Agrawal, who's in Tamil Nadu. She's just coming from Chengalpattu district on the highway on the way back to Chennai. Soniya, you've been covering the story of the oxygen deaths in Chengalpattu. A couple of days ago, 13 people have died from inadequate oxygen pressure in a hospital. Can you tell me exactly what happened and where you are right now? You're on the highway, but tell me where you are.
So I am basically almost close to Chennai. I'm in Navalur, and Chengalpattu lies about 53 kilometers away from Chennai. So it's like a short hour-long drive from Chennai. The roads are also very good, so it's not an issue. And several people, up down from Chengalpattu to Chennai to work. And so what happened in the Chengalpattu government hospital was that on Tuesday night there was a drop in the pressure levels of the oxygen tanks that they have there. And this story I will be filing today, and you will see it on the print very soon, is that the oxygen, the oxygen level basically dropped, but the dean of the hospital told us today that that is not what was the cause of death of people. These were people who were suffering from COVID, and the death was simply an outcome of the disease and not because of oxygen problems. The facility there has a 23 kilowatt kind of plant, so they can produce enough oxygen to support the 400 plus beds that they have.
So obviously this is a big government hospital if it has 400 beds, Soniya?
Yes, it is. Actually, Chengalpattu is the second worst affected district in Chennai, in Tamil Nadu, after Chennai. And people from nearby districts also come to this government facility for getting treatment.
Okay. Viewers, please do send in your questions. We have Soniya Agrawal for the next few minutes answering your questions. Soniya, tell me the general situation in Tamil Nadu.
So as of today, since today was an important day for the state, Chief Minister Stalin, held the swearing-in ceremony. He took his oath, and there were 5 orders that were immediately signed and passed by him. Some of which, directly have some kind of, you could say, relation with COVID. One is he has offered to give 4,000 and 2,000 rupees respectively to households and ration along with that. Subsequently, he's also reduced the price of milk by 3 rupees. He's also assured people that people suffering from COVID who go to private hospitals, if they cannot afford it, their bills will be paid from the Chief Minister's Health Insurance Fund.
I see.
So this is what the situation, from the political front as of now looks like. COVID has definitely, and the crowding of Chengalpattu hospital definitely indicates that now COVID-19 has spread into rural areas of Tamil Nadu. Of course, when you compare it to northern states like Uttar Pradesh, the situation is not as bad, because the health infrastructure that we saw today in these small districts does seem to be robust enough to handle, even a caseload of up to 50 patients a day.
Right. So, Soniya, can you just describe the state of the hospital, this 400-bed hospital that you went to?
I'm sorry, can you repeat?
Yeah. I said you said the state of the health infrastructure is much better. Can you describe to me this hospital that you went to? Tell me a little bit about it. Yeah.
So this hospital that we went to, it's divided into 3 buildings, and each building has its own oxygen plant which supplies oxygen flow to them. So that is a commendable thing. Another thing that we saw was this hospital is also handling the case load of OPD patients and emergency patients, along with pregnant women are delivering babies in this hospital. Cases of suicide, um, brain problems, neurological problems, basically. So all these things are simultaneously happening in this hospital, along with taking in an OPD of COVID patients of up to 80 people every day. So, and this is something that we have seen in hospitals of, say, Delhi, where, OPDs shut immediately after caseload increases. So this is something commendable in this, that we were able to see in this hospital, and in smaller districts too. In one of the districts that we went, we saw that hospital had vacant beds, and there were the medical officer, the in charge there, basically the dean of that hospital, told us that they had capacity to run 50 oxygen beds, which they had kept in reserve as of now, in case if the Chengalpattu hospital, the main government hospital, runs out of bed. So the provisions are already, starting to be made. Provisions are being put into place in case the caseload increases.
Mm-hmm. So tell us a little bit about the mortality and the caseload. How is Tamil Nadu coping with that?
So as of today, Chennai obviously continues to remain the worst affected city in the state. And on Thursday, Tamil Nadu had about 25,000 new cases, so taking the COVID toll to a little over 1.3 lakh COVID cases. And in terms of active cases, as of now, the most number of active cases are in Chennai, Chengalpattu, and then coming close behind in Coimbatore.
So obviously this is around the big cities, Chennai, Coimbatore, that's where the cases seem to be the highest. And Chengalpattu, as you said, it's about 50, 60 kilometers from Chennai, and people who go up and down, they are probably also at the risk of being exposed and therefore infected. But what about the villages? I mean, I'm sure you went to some villages. What is the situation like there?
Yeah, so we went to two villages today, and the biggest problem with Tamil Nadu as of now is not so much as oxygen or a heavy COVID caseload, but here the problem is vaccine hesitancy, which has become a very big issue for the state government. I think it will be a bigger issue in the days to come as the new government steps in. Is that people are really afraid of getting themselves vaccinated. We went to two vaccination centers today, where one in charge told us that we finished one vial. We gave 10 doses today. 10 doses can be given out of one vial. So they said we finished one, and whoever, like one or two people came after that, we are not giving vaccine to them. We're calling them tomorrow so that the vial doesn't get wasted. And when we spoke to people, they tell us that they've seen other their colleagues and friends suffer from side effects, which is why they are not very keen on getting the vaccine. And Tamil Nadu, very importantly, has seen the highest vaccine wastage so far. It's about 8.8%, which is the highest in the country. So from an educated state, vaccine hesitancy is a common trend that really has baffled people.
But are you saying then that the vaccine hesitancy is both in the villages as well as in the city?
Well, the cities are seeing, a kind of an uptake in the number of people coming in for vaccines. If you look at the local reports, they do show people flocking to centers. Here in Chennai, the problem is not vaccine hesitancy. The problem here is vaccine shortage. So in urban areas, people are looking forward to getting themselves vaccinated, but in rural areas, because I believe misinformation and lack of information is what is driving them towards this fear of not getting vaccinated. Another important thing that we found was that the vaccination for 18 plus 18 to 45 age group people has not started in rural Tamil Nadu as of now. Chennai started a few days back, but in that as well, from news reports we gathered that there's only a limited dosage that is being used as of now, of course, due to vaccine shortage. But in rural areas, this drive hasn't started yet.
Right. And Aditya has a comment for you. He said he got his first jab in Chennai today. So which basically, confirms what you're saying, which is that while in the cities, like in Chennai, the vaccines, the people are getting their vaccines, younger people, but in the rural areas, they're not doing that. That's not happening.
Right.
Okay, so so did you meet any of the new MLAs, Sonia, and did you to get a sense of what's happening on the ground, because this would perhaps be the first big challenge of the new government that's just that has just been sworn in.
Unfortunately, no. Since we've just started out today, this is our first day of reporting in Tamil Nadu. So we haven't had the chance to meet with any MLAs or political leaders as of now. But I will keep you updated, and if and when we meet, these new MLAs, we will definitely write about it.
So, Sonia, there are some thoughts and some questions on migrant workers. A lot of people from UP, Bihar, and other parts of North India who work in Chennai and who work in the big cities of Tamil Nadu. Did you find that they're going back to their villages? Our industries and factories shutting down? Is there a shortage of labor?
On the contrary, I feel this time around people have decided to, stay back. We had stopped for lunch in Chengalpattu outside the district collector's office, deputy district collector's office, and we met a boy from Uttar Pradesh, and he said that I don't want to go back this time around. I'd rather stick around here. And because of the state-imposed curfew/lockdown post 12 in the afternoon, the roads are empty, they're deserted. So people are not venturing out. The bus stations are also not crowded as of now.
There doesn't seem to be a lockdown right now because you see a lot of traffic on this highway.
Yeah, that is true. But if you go into, if you look at shops, these are possibly commuters, but shops, any other facilities, everything is shut.
Right. So the lockdown is across the state, and you said what time is it like is it a nightly curfew, or is it sort of a full day lockdown? How is it?
So basically, the state government has asked, essential shops to be open from 8 a.m. to 12 in the afternoon, and specifically asked non-essential shop owners to not open their shops through the day.
Okay.
And that's about it. And people seem to be following this, rule. All shops across the rural and urban areas are shut.
What about the Chennai? Is Chennai more or less shut down?
Yes, more or less, large parts of Chennai are shut down as of now.
So I have a question on the temples. Although there's a lot of, the government itself is, the DMK government is supposedly, at least theoretically, atheist, but a lot of the people of Tamil Nadu are very deeply religious. There's lots of big temples, including in Chennai. Are they shut as well?
Well, Jyoti, we haven't visited any temples, although we are very close to the old Mahabaleshwaram road, Mahabalipuram.
So a couple of other questions for you. One is Suganya Sibaswamy is asking that there is a vaccine shortage, like you said, for the younger age group, 18 to 45. So are you saying that, do you have any more comments to make about whether this vaccine shortage can be improved? What are the doctors saying? What is the chief medical officer saying, the one that you met in the hospital?
So as of now, the health ministry also in its press briefing, issued a statement saying that give more preference to people who are, seeking their second dose in order to get better immunity and get people more protected of the higher age group. And of course, the center has asked state governments to purchase vaccines from manufacturers, and that is an issue that is basically troubling states, that the vaccine manufacturers don't have enough to provide for.
Mm-hmm. Okay. I have one or two questions more for you, Sonia, before I let you go. So Ayan Achar is asking, do you need an appointment for a 45 plus age group? Do you know that, or is it just walk-in? Do you have any
Well,
information
in
on
rural areas, we saw people walk in,
that? Okay.
and in Chennai, from as much as I know, you do need a registration to go and get yourself vaccinated.
Okay. Deepak has a comment rather than a question, but perhaps you can, talk about that a little bit, about the consequences on the economy from a lockdown.
I'm sorry, if you could please
Yeah,
repeat.
so Deepak has a comment, and he's asking that he's talking about, how when you lock down an economy, it has very serious consequences. And that's perhaps why Tamil Nadu has not locked down completely like it did last year. Just like actually Prime Minister Modi also a few weeks ago when he addressed the nation, he recommended that the state governments do their own local lockdowns and according to the situation in which. So he wants to know if you have a comment on that, about the impact of on the economy. Are people complaining, for example, and saying that, there are no jobs, so what are we supposed to do?
I think this was now that this is the second year of facing a problem that we are not able to see an end to. People, so far we have not seen people complaining of regarding businesses being shut or shops being shut in Chennai and nearby districts. But it's noteworthy that how during lunch hour, what is called supper here, during that time only food shops were open in the areas that we went to. After which they said that they will shut down their. So as soon as they said that will shut down. So I think people of Chennai and Chengalpattu have also really thought about things, and they're really opening shops when required, when buyers will actually want to buy the produce or whatever product they're selling.
Right. Right, Sonia, I'm going to let you go, but stay safe, mask up, keep your double masks always in place. And thank you for answering these questions. Viewers, thank you for watching. This is the COVID Live at the Print